How are liver disease and alcohol use related?
The relationship between alcohol consumption and liver disease is well established. Regrettably, use of alcohol is associated with the development of liver disease in individuals who consume alcohol in general in substantial amounts over a prolonged period of time. The types of liver disease that we see in individuals who drink are fatty infiltration of the liver, inflammation in the liver, and then subsequently the development of cirrhosis within the liver, which is associated with liver failure, death, liver tumours, and the need for liver transplantation.
How can we reduce alcohol-related liver disease in society?
We can reduce the harms associated with alcohol by reducing alcohol consumption. It's that obvious. So there are very strong arguments for individuals with liver disease due to alcohol abstaining from alcohol, and with society facilitating that by the use of measures such as minimum unit pricing, such as a ban on alcohol-related promotions and advertising.
What should consumers know about alcohol and its relationship to liver disease?
First of all, it's clear that there is no safe level of alcohol consumption, that all alcohol consumption involves a certain amount of risk. We believe that alcohol products should carry full mandatory listing of ingredients and a nutrition declaration, and indeed should also contain health warnings, especially regarding the harms to the unborn child, the risks of cancer, the risks of liver failure, and the risks of death. Regrettably, Europe is the region in the world with the highest level of alcohol consumption. And alcohol consumption in Europe is about 10 litres of pure alcohol consumed per individual per year. We know that there are over 900,000, close to 1 million deaths in Europe a year as a result of alcohol. The costs to society in Europe run into hundreds of billions of euros every year. The alcohol industry does not contribute to paying for the cost of these harms in terms of healthcare, in terms of social services, in terms of crime and the prison system and the justice system.
What can hepatologists do?
Well, first of all, we can treat patients who've got alcohol-related liver diseases to the best of our ability. Second, we can train healthcare staff to help and care for patients with alcohol-related liver diseases and raise awareness of these diseases. I think it's particularly important to adopt an attitude that patients with liver diseases related to alcohol are victims of the alcohol industry and need to be looked at in that regard. It's worth saying that despite the recognition of the harms associated with alcohol use, the history of alcohol control lags substantially behind tobacco control efforts.
How can your work at the European Parliament make society a safer place with less alcohol use?
The work done by the Beating Cancer Committee in the European Parliament and the launch of the EU's Beating Cancer Plan are both very important. They have highlighted how much of a risk alcohol is, and now we can take action to ensure that people are fully informed and can then make informed choices about their consumption of alcohol. One measure we can take, for example, could be considering banning the advertising of alcohol to minors, for example, including at sports matches. We can look with the member states at such advertising and see if it is a good idea. In addition, we can look at the labelling of alcohol products, which the EU has a big say in. Alcohol is a dangerous product, but is not labelled so. Perhaps this needs to change. And of course, the European Parliament can work with the member states and the European Commission to initiate information campaigns to educate people as to the risks.
How have you made a positive change in Ireland to tackle the burden of alcohol?
I think that the main change that Ireland made to tackle alcohol abuse was to introduce minimum unit pricing of alcohol, which came into force of January of this year. By putting a minimum price on alcohol, we are making it less accessible, particularly for minors, for young people, and encouraging people to really consider in what volumes they want to use it. Wales and Scotland have already taken this measure, and it seems to be showing promising results. However, we now need to move to measures such as banning the advertising of alcohol at sports events. This glamorization and positive assertion of alcohol with sport must be broken to ensure that people can be fully aware of the risks of alcohol.
What are the key obstacles you encounter?
I think that lobbying activities by alcohol producers are really difficult to overcome and to counteract. While large companies have much more resources to put into lobbying, it is the smaller growers and producers who are already under a lot of pressure that are actually the more persuasive to politicians who see these difficulties and, of course, are sympathetic to their constituents' fears. We saw that when we voted the final report of the Beating Cancer Committee. It was MEPs who represent constituencies where wine producers, for example, traditionally are, that had the most problems with the alcohol-related section. I understand these difficulties, but they cannot come at the expense of public health. And we need to consider the well-being of society as a whole when it comes to alcohol.